We're an educational site for family medicine residents, so the presence of the PharmDs helps us with educating them in terms of appropriate medications to use, dosing. There's also a huge advantage to patient education as well. The providers can prescribe medications and then go on to see the next patient, while the PharmD, the pharmacist, can go in, spend some time with the patient, and that's tremendously helpful to the providers because it's very time consuming and it frees us up to go on to see more patients.
And when we're seeing patients with the physicians, we are teaching them some of our tools and our focus. And I think when they leave here for residency, they either incorporate that into their care or expect that when they leave they'll have a pharmacist to work with.
I find it very insightful to have a pharmacy resident and a pharmacist as part of the team because they bring a different aspect to the patient visit than just the physician resident medical student.
A member of the faculty of the physician residency, I've been here for 15 years in that role, and I had been a teacher of these physicians for many, many years, and so it's really interesting to me to bring pharmacist learners into the mix, not just a pharmacist teacher. We've had pharmacy residents here for 6 years now, and they have participated in the faculty development fellowship program with physicians, and this has really enabled them to train alongside physicians. So we've got pharmacy residents with physician residents and physician fellows exploring their role both as teachers and as service providers.
I really feel like part of the team. I feel like when I see patients with the residents that I'm involved in pretty much every decision that's made, which is great. I think that's kind of ideal patient care.
It is a blessing for the Northside Christian Health Center to have the pharmacy students from the University of Pittsburgh to do their service here at our community health center. I mean, these students are absolutely dedicated to what they do. They come in, they have a purpose, they have a mission that they want to accomplish, and it is a joy, really, to see this enthusiasm that these young people bring.
I've been working with the P1 students for 3 or 4 years, and they've been doing a variety of things. We get a lot of patient assistance medications with the pharmacists working through that, and they help us with that. They've also helped with the patient safety initiative, done a lot of research, and called patients. They've found out that our patients get drugs from many different pharmacies, they get many different kinds of drugs, so there's a lot of problems that they found.
We got to participate in a few projects, the diabetes project where we gathered information about 36 different patients at the health center. We compiled graphs and charts to see how these patients' A1C levels are going down or up. It was great to see how a lot of the patients were able to lower their A1C levels based on the MTM visits.
One thing we reinforce in class is the concept that each patient is unique and comes from a very different background and has many different issues that they may be dealing with, and I think this just reinforced the idea for me. You hear about it in the classroom and then you come and see it in real life, and that definitely reinforces it more than just talking about it.
And so it is our hope and desire that as these students walk in this environment and they almost instantly see the results of their efforts, because the results are people are getting better. People will live because of the service that they render.
Interdisciplinary care is just vital to our patients' outcomes. And this really means not just our clinicians, our pharmacists, and our physicians, but the entire staff. I think what's most beneficial for us is the collaborations that we've brought together with the School of Medicine at the University of Pittsburgh and the School of Pharmacy at the University of Pittsburgh to provide all of this care on site.
And we've been in collaboration now for over 10 years. Some of the programs, some of the initiatives are newer, but that stems from the relationship that we have had.
One of our newest initiatives is what we call our refill clinic, which is really a disease state management clinic where patients are referred to our program and we're able to adjust their medicines based on a protocol. By being able to provide that direct level of care to patients, it's really given us a lot more ownership over some of the things that we do at the clinic. And we can be more proud of the results that we have when we see that our diabetes patients have better A1Cs and better lipids and better blood pressure control, and we're getting closer to goal.
Working with pharmacists on site from the School of Pharmacy allows us to tailor patients' medications, therapies appropriately and guide us in a particular formulary so that we know if we're ordering medications through Healthcare for the Homeless or we're purchasing them out of our own budget, we're purchasing exactly what we need.
So we're able to care for a large number of patients with really complex chronic medical conditions with a very small drug budget.
And the part that I think is really neat is the refill clinic where patients come back and they get this one-on-one time with the pharmacist who go over their medication, counsel them. And so I think that's an ideal partnership. I don't think one can do without the other. And I think just in general, I think our healthcare system, I mean, they are recognizing that more now, but it's much slower than I think it should be. So. Right.
This has been an enormous opportunity for me to speak with patients directly, to work with physicians, and to dispense medications all in one building. And it's just a very special, unique environment, and I feel very lucky to be here.